Hello, welcome to Medication Station with Mello, your hub for essential drug and health information. Our aim here is to empower you with knowledge for educational purposes only. Always consult a trusted licensed medical professional for individualized advice. Our topic for today is brand versus generic drugs. Understanding the differences can help you make informed choices about your medication. Let's talk about the differences, shall we? Our first segment has to do with the basics. Brand name drugs are developed by pharmaceutical companies and have a unique name. The approval process for brand name drugs involves extensive clinical trials and testing to prove safety and efficacy. These drugs are often covered under patent protection for a stipulated length of time. Generics, on the other hand, are copies of the brand name drug containing the same amount of active ingredient. Generics must demonstrate bioequivalence to the brand name drug, meaning they have to deliver the same amount of active ingredient at the same rate. This helps to ensure that they are therapeutically equivalent. Both drugs, however, have to meet the same rigorous standards set forth by the FDA, otherwise known as the Food and Drug Administration. Our second segment has to do with cost. This is a very noticeable difference. Brand name drugs tend to be more expensive than their generic counterparts due to research, development, and marketing expenses incurred by the pharmaceutical company. Generics are usually cheaper because the manufacturers don't have to repeat the extensive clinical trials that the brand name manufacturers undergo. Generics are by no means substandard, contrary to what some may think. Generics are allowed into the market once the brand name manufacturer's patent expires. Our third segment has to do with appearance and packaging. Brand name drugs have distinct appearances and packaging to help with recognition and branding. In other words, no matter where you go, the brand name drug will look the same. Generics, however, may vary in appearance and packaging depending on the manufacturer, but the active ingredients remain the same. Don't be alarmed if your generic drug looks different from the brand name manufacturer you're used to, or even another generic manufacturer. It is normal. Our fourth segment has to do with quality and effectiveness. As mentioned earlier, both brand and generic drugs are held to the same quality standards, even though the inactive ingredients may differ. These inert ingredients do not interfere with the therapeutic effects of the drug. However, some individuals may be sensitive to them. Always share your concerns about these ingredients with your healthcare provider. Our fifth and last segment is about switching between brand and generic. In most cases, switching between a brand name drug and its generic equivalent is safe, effective, and allowed by law. If you experience any unusual side effects after switching, please be sure and discuss them with your healthcare provider. In summary, brand name drugs and generic drugs are similar in terms of active ingredients and therapeutic effects. The main differences lie in the cost, appearance, and inert ingredients. It is essential to communicate openly with your healthcare provider and share your concerns and preferences. This concludes our topic for today. If you did not know all this, now you know. Thank you for watching. Please subscribe, share, and comment below as to what you would want us to discuss in the future. So long, Mello.